Hey you guys, this is Ryan Fan here at Reform Prosthetics in Savannah, Georgia. So we are continuing our educational series, and today I'm going to talk about volume management, and that's managing the volume of your residual limb with respect to your socket system so that you can maintain appropriate pressure distribution and keep your limb protected and healthy. So the way that we do that is, as your limb is encompassed in your prosthetic socket, the pressures are going to push fluid out, causing your limb to shrink. As that happens, you're going to start having more pressure at the bottom of your limb, and sometimes that can be uncomfortable. So to compensate for that, we utilize different socks. So they come in different thicknesses: 1 ply, 3 ply, 5 ply, and there may be different other plies as well, but the objective is for you to apply these socks over your gel liner or residual limb with the appropriate thickness to compensate for that volume loss so the pressure is redistributed appropriately and your limb health can be protected. Also, your stability and your confidence will be positively affected by this as well. So they make these socks in different lengths. So here's a standard length for a BK, here's a shorter one, and these are just to help you micromanage because you don't always lose volume equally. You can talk to your prosthetist about which socks, as far as thickness and length, are appropriate for you. Now, the reason I picked this subject is because I believe that volume management done successfully can eliminate about 80% of prosthetic problems. That's just my theory, but I stand by that. So the reason for it is when you first put on your prosthesis, it's going to fit as tight as possible in the morning or when you first put it on. The more you walk, you're going to lose volume and it's going to shrink, causing your shin bone to move back and forth, and it's going to create damage to your skin, possibly bone, and cause you to probably not be able to wear your prosthesis. So what we know factually is that within the first 4 to 5 hours of using your prosthesis, you're going to lose volume, and as that volume is lost, if you do not compensate for it, there's going to be too much movement and there's going to be uneven pressure distribution. A good example is what I have here. So here is a jar full of sand and it's filled up to the top. So this is a well-fitting prosthesis. As I'm shaking it, the sand isn't moving, so everything is nice and stable. So now I'm going to give you an example of what a loose socket does. Sorry, had to pour the sand out. So I poured a little bit of the sand out, and this will serve as an example of losing some fluid in your limb. So now, as I shake it, you can hear the sand moving around, and you can actually see it moving. Pretend that's your shin bone or your femur bone. No one would want their bony anatomy to be moving around like that while they're trying to be active, because it would be painful. So again, these socks can save you a lot of heartache and pain. You should always have them with you when you visit your prosthetist, your therapist, or just when you're out in the community, because you never know when you could use it, and it could certainly save you a lot of heartache and pain. And shout out to a colleague of mine in Dallas, Texas, Kai Davis. He just started his own clinic called Kai Davis Prosthetics. His motto is sock yourself to comfort, or is it sock yourself to happiness? Regardless, it's a great saying, and it can make a true difference in your outcome. So that's all we have for you today. I hope this is helpful. And again, speak to your prosthetist before making any of these adjustments, because they can help guide you to the correct outcome.